Will dental implants cure gum disease? Another great question. So, gum disease is the process where you've lost bone and gum around your teeth. It's caused by an infection. It's called periodontitis. And that means that your teeth will eventually loosen up and fall out, right? So that can be one tooth falling out, two teeth. It can mean all of the teeth falling out. So the question about will implants cure gum disease, the easy answer is no. So in order to have dental implants, let's say you're having just one implant put in over here. You have all your other teeth and you're just having one molar implant put in. You have to have a healthy gum condition throughout the rest of the mouth. So that one implant can really be, attacked by the gum disease on all of the other teeth onto the new implant. So the whole mouth has to be healthy. So don't be surprised if the dentist says, hey, in order to have this implant, we got to clean your whole mouth before we can put that implant in. That's a sign of a good dentist. Having a great cleaning beforehand, especially if you have gum disease. If you just have, regular, hasn't been to a dentist in a little bit, if you have active gum disease, then certainly that needs to be controlled before ever considering an implant or a bone graft. Definitely the number one most important thing. And so it does not cure gum disease. And remember, gum disease is really turbocharged by smoking. So most people that have gum disease either smoke or have smoked for a long period of time. The saying, it's not really funny, but it'll stick, is you can either smoke or you can have teeth, but you can't have both. So smoking is a huge part of the process of gum disease. So will dental implants cure gum disease? No. The only time that it will is if all the teeth have to come out. By removing all of the teeth, you've removed all of the gum disease. You cannot have periodontitis around no teeth, right? But you're more at risk for developing gum disease around the implants, right? Because implants are not permanent at all. So if you're a smoker, you have a history of a gum condition for a long period of time that was never really straightened out, and you have implants and you don't care for them or maintain them, then that same gum disease will return. You'll lose gum and bone around the implants and eventually lose the implants as well. You may lose all of them, you may just lose one at a time. That condition is often referred to as peri-implantitis, which sounds very similar to periodontitis. So one is infection of the teeth and bones, the natural teeth, and the other is an infective process around implants. That one's called peri-implantitis. So oftentimes, dental implants will not cure gum disease, but oftentimes the patient doesn't know they have gum disease. So they come to me, they're missing one tooth, and I'll say, hey, you have gum disease as well. Oh, I didn't know I had that. Let's take care of that first. So I teach them a lot of things that they need to know about how to care for their gums, how to floss, how to water pick, obviously diet and lifestyle counseling, alcohol, tobacco. Those are big parts of my discussion I have with patients. And once we get the mouth healthy, hopefully it's been a kind of an awakening, an awakening to do better in the future, so you don't lose a tooth due to gum disease. Most people don't lose one tooth due to gum disease. They lose one tooth due to a bad root canal, a crack, a really bad cavity. When they have gum disease, they're usually losing more than one tooth. So, and oftentimes, let's say there's very few teeth remaining, or there's only 10 teeth remaining, and those teeth have gum disease. A common question is, well, should I replace just those other 10 teeth that are missing, or should I take them all out and replace all of them? Almost always it's better to remove all of them. I find that the gum and bone is more stable if the gum disease has been eradicated by tooth removal. Remember, the only way gum disease can be removed or gotten rid of altogether is to remove all of the teeth. That's the way that we can prevent having the same bone loss problems on the implants as well. And that's again with regular maintenance. That's twice a year visits to the hygienist, x-rays usually once a year, having me see you as well to check in on the implants, check in on the bite. Those are things that because we never can cure. There's really no cure for gum disease. There's treatment for gum disease, and our treatment is really daily home care. How to keep your implants clean, how to keep your health, how to keep your own, how to keep your teeth clean. Dogs and cats, they have gum disease. Well, if we don't care for their teeth, get them cleaned as well, they will lose their teeth, and there is no. So the cure is there's no cure. It's just treatment, daily treatment at home, plus with your dentist, and obviously don't smoke. Do all the things you're supposed to do to have a healthy mouth. But that's really the answer for can dental implants cure gum disease? The answer is no. And have a healthy mouth before ever having an implant or a bone graft done beforehand. Really super important. Thanks for watching.